Hi, everyone. So for our project, we decided to interview a few people who have a little bit more experience with disability than we do. Uh, for the first one is a friend of mine named Taylor, and he has a connective tissue disorder, and he has a lot of experience with the medical field. The second guy, Noah, will introduce.
So we interviewed a guy named Yarden, who is a program director at the Friendship Circle, which is a program that helps children with neurodevelopmental disabilities on the autism spectrum or with Down syndrome. So we interviewed them both, and we asked them three similar questions. And so our first question was any positive interactions that they've seen with medical professionals.
The second question was describe any negative experiences that they had while interacting with medical professionals.
And the final question was just any advice that they had for us as future budding physicians on how we can be, good professional physicians.
And so we're gonna play some clips from the interviews that we had and pull out some of the good things that they had to say throughout our interview process. And they're going to start out by describing what they do or the medical issue that they have, and then they'll go throughout those questions, and then we'll synthesize it at the very end.
Yep, hope you enjoy.
Version. It's a connective tissue disorder. It's like a single gene mutation, they think, that just affects like all the connective tissue, ligaments, tendons, whatever, all that stuff, and makes it like denser than most. So it makes it a lot tighter. It doesn't affect. They did like a muscle biopsy when I was really really little, and so it's not like a muscular thing. It's only the connective tissue.
Interesting.
There's a lot of things like arthrogryposis is one that's kind of like it, where people have similar side effects, but there's a whole lot of other stuff. So like what I have isn't really like part of that, but they call it arthrogryposis like connective tissue disorder, but I'm the only person that I've met or heard of that has something similar.
What it's trying to offer to people in isolation is community, friendship, and support. So through our special needs programming, we're not doing therapy, though we are using therapeutic tools to offer, again, those things. We do it primarily through teens in the community, being paired one-on-one with children with special needs. I got involved as a teen volunteer coordinator and ultimately the teen director, engaging teens to get them to volunteer, as well as now we also offer teen engagement programming as a way of also offering community to teens that feel isolated. So that's a little bit about Friendship Circle and what we do.
I guess we'll start with some positive. What are some positive experiences that you've had with medical professionals as you've sought their advice and their expertise?
I think one of the first like really like good experiences I had that I can remember was when I was little. I had a occupational therapist named Kate, who was like really really good at like evaluating people and what you needed like on an individual basis, not like using previous knowledge or comparisons. Like she'd like, okay, what do you need to do, and how can we make it so that you can do it? Not like how do we get you to normal, how do we get you to to like this like external goal of whatever. It's like, what do you want? And like I was really little, so it was more like, what do my parents want me to do, to be able to do, and how do we help you do that? And that was really like a huge I think benefit to me, at least when I was really little, because it was like things like because I was born like in kind of like the shape of a football almost. Like I was just like very like tight, and they had like extend, like we did like serial casting, we did all kinds of like stuff, but like things like she helped me like do things like button shirts and do things like that, and like get to a point where I was like a normal 4 or 5 year old kid who could do the normal things. But that was I think that was one of the more beneficial, but just the way she could like evaluate me individually.
That's awesome, and that's a big theme that's been coming up in our discussions too in our disabilities class, is how like kind of how the society defines like normal versus like what the people themselves actually define themselves as normal. So I think it's a big point. So thank you so much for bringing that up.
Yeah, that's a huge. I was thinking the same thing. That there's the term normal is thrown around really loosely, like, oh, we're all supposed to be normal. What level is normal? And we grade it on this. We talk about this bell curve, like everyone should be at this in this bell curve. But in reality, normal is a spectrum that really comes down to the individual and their
normal is
individual
just a
needs.
statistical, like
Yeah.
a useful statistical idea.
Yeah.
Right.
Exactly.
So, like, I remember for a long time, there was a lot of focus on, like, because, like, with walking and because I walk on my toes.
Yeah.
Because of the constrictions on my, like, hips, then double up on my knees, and then my, ankles, it's all tight, so it kind of makes it so I walk on my toes. And for the longest time, the, different orthopedists and other people were trying to get me to walk on my heels.
Yeah.
And we use, like, AFOs and, like, splints and stuff. And they tried all kinds of different things, and then, like, I think it wasn't until, like, I don't know, maybe it was when I moved to Utah, so probably 2018.
Mm-hmm.
So I was like, what, 15 or something, when we went to the Shriners Hospital, and they're like, yeah, this is kind of pointless trying to get you to do that.
Yeah.
Let's just put some heels in your shoes.
Yeah.
And, like, so, like, they put some what are they called? Orthopedics? What are they called?
Orthotics.
Orthotics. Orthotics, there you go.
There you go.
They put orthotics in my shoes, and it was like, oh, well, that's helpful. Like, that makes it so that I don't get this, like, weird cramping in my foot. Cool. Like that was all they needed to do. Like, they didn't need to make it so that I could walk on my heels, because everyone walks on their heels.
Yeah.
It's like, how can we make you be able to do what you want to do, which is walk,
Yeah.
and without having pain or being really, really sore all the time or something.
Yeah.
I think ultimately acceptance and allaying of fears, like even something simple like the nurse greeting like a family like that has a child with special needs and saying, "What can I do to help make this a pleasant experience for you?"
Yeah.
Sometimes, unfortunately, not because of the doctor's choice, the schedules get very thrown off, and you can end up in a waiting room for a long time. And not to say that can be avoided, but ultimately communicating that effectively with the family so they can learn, how to best plan for that, or even when the doctor comes in, how to, understand and ask the family, like, what can I do to help make this a successful experience? What tools do you have that'll work?
Yeah, so our next question is, can you think of any particularly negative interactions between, like, some of the children in your community and, like, a medical professional, and, like, what went awry there, and what could be done to, like, prevent those types of interactions?
Yeah, it's a great question. First of all, I mean, thank God I've seen a whole slew of very awesome medical professionals. Mm-hmm. It's interesting because I just heard a study that the average patient needs 120 seconds to communicate what's bothering them, and the average doctor gives them about 18 seconds to communicate that.
Oh, wow.
And then you talk about a child with special needs, or you talk about a parent of a child with special needs, and they're probably going to need more time than that.
Yeah,
they're probably going to need, like, and then is the doctor giving them that time so they can feel like they're successful, and they can feel like they're getting what they need out of that journey that they made. Mm-hmm. The other thing that I think I've seen is sometimes, not to blame the doctor in any way, but again, they think they know what's up right away and they jump to that conclusion. And, it's more challenging to really diagnose what's going on with this child with special needs, and also all the components that are at play that might be making that thing go on.
Right.
I think it's like, it's not necessarily as much negative as it is just like kind of like frustrating, or like a little bit like non-helpful, I guess.
Okay.
Like there's only been a few times where I was like kind of like annoyed at a doctor, or like I thought that they were like actually like it was like a negative experience. Most time it's like, well, that was pointless, So like, but I think as far as negative goes, there have been like times where I will go into a doctor and they'll be like pretty uninterested in solving my particular problem, because they don't know already how to solve it. Like, I think a lot of the ways, and this kind of goes into more of a systemic thing that you probably can't really tackle, but like, as far as the attitude goes, doctors tend to seem like they're more interested in turnover.
Yeah.
And going and kind of getting through, and also like, even if they like were at one point like interested, which I'm assuming they had to have been to specialize in something, they are kind of like conditioned to like say, well, I don't know how this is, I'm going to refer you to someone else, and they have no idea who to refer me to. They just want to pass it along to the next person.
What advice or what suggestions do you have to people who will be working with people with disabilities, and in order to make the experience better and to really meet that person where they need it?
I think if I could say maybe three pieces of advice. One would be like, first, like evaluate individually, like we talked about before. Look at someone and be like, okay, who is this person? What do they need to do? What do they want? What are their health concerns? Because sometimes it's not like a task you want to do, but it's like, oh, I'm feeling this way about pain or whatever. Evaluate that and think about like how them as a whole, like not just what you're researching or whatever can help them. And then two, like be interested in solving problems.
Yeah.
Like it's just like it just boggles my mind that like someone who is they're like taking that oath to like help people, and they're like that's their whole job is to heal people. They don't care, about solving an issue if it's not like immediately solvable.
Right.
And then I think last would be to assume that the person you're like at least start from a place where you're assuming that the person you're talking to probably knows, at least in one specific area, more about what's going on with their thing than you do. Because I think a lot of times I get talked down to, and they're like they treat me like I've just like did some WebMD research, when it's like no, I know at least a lot about what I'm going through specifically.
I think you've already touched on this in a couple of different ways. Ultimately, I think I actually heard this study about work. A lot of times we want to look at one thing about somebody, and that's like our thing. And ultimately, in today's day and age, it's like a whole person approach. And when dealing with somebody with special needs, it's really a whole family approach. It's, am I going to tell them to do something that they just can't do? And then how do I cater this to something that they can do? And what's the whole picture going on? And for example, if I say that someone needs physical therapy 3 times a week, and I just write that off and give it to them, and ultimately their schedule is already beyond maxed out, and they're not going to do it, then I need to be able to have that conversation with them and say, where are we up to? What's practical, and how do we cater to this whole picture?
So thank you guys so much for watching. I hope that you guys got as much value out of that as we did. It was really a joy to interview with them and to learn what they had to say.
Yeah, we hope that you can take a lot from them and learn from their experience. And we look forward to discussing it with you guys next week.
Yep.